Hi, good day. My name is Rakin and I'm from Misike, and today we'll be talking about pneumonia. Okay, so a few things we're going to go through. Firstly, some statistics relating to the Malaysian population, and then we'll go through the definition, types and causes, signs and symptoms related to pneumonia, some risk factors, diagnosis, treatment, and some ways to prevent from getting pneumonia. So here we can see abstract from an online article from Malay Mail. It says that uh, Chief Statistician Datuk Seri Muhammad Uzair Mahidin recently reported that pneumonia accounted for 18,181 cases, or 15.2% of the 119,952 medically certified deaths reported in the Statistics of Causes of Death, Malaysia, in the year of 2024. And in 2000, it is responsible for less than 5% of the recorded deaths. And here you can see a poster from the Ministry of Economy, Department of Statistics, Malaysia, for the year of 2024, the 10 principal causes of death 2023. And pneumonia is ranked number one with 15.2% of the causes of death. And when you look at the percentage from men to women, so for men, the principal causes of death is ischemic heart disease, whereas for women is 16.4% is pneumonia. Okay, here we have another abstract from another news outlet, it's Star, and says that pneumonia is the top killer in Malaysia for 2023, with over 18,000 fatalities. So Muhammad Uzair said that in 2023, 12,648 male deaths, or 17.6%, were due to ischemic heart disease, while the leading cause of death for females was pneumonia, which accounting for 7,815 deaths, or 16.4%. And when looking at the pneumonia-related deaths among the ethnic groups, within the Chinese and other Bumiputra ethnic groups, 4,887 deaths, 16.4% were from Chinese ethnic groups, whereas 1,255 deaths, or 12.2%, are from the Bumiputra ethnic group in 2023. So let's look at the definitions relating to pneumonia. So the word pneumonia actually comes from the Greek word pneumon, which means lung. And the word pneumonia is a new Latin word that was first used in the 1600s, and it can be translated to lung disease. So pneumonia is an inflammation of the lungs that can affect one or both of the lungs. It's often caused by a bacterial or viral infection that can also be caused by fungi or parasites. When someone has pneumonia, their air sacs, or we call them alveoli, is filled with fluid, which makes it difficult to breathe. Now, here are some common terms relating to pneumonia. First, we have HAP, or hospital-acquired pneumonia, also known as nosocomial pneumonia, is a lung infection that occurs in patients at least 48 hours after being admitted to a hospital. So it's usually caused by a bacteria type of bacteria and can be very serious or even fatal. Then we have another commonly type of uh, category of pneumonia, which we call CAP or community acquired pneumonia. So community acquired pneumonia is defined as pneumonia that is acquired outside hospital, and the most commonly identified pathogen is Streptococcus pneumoniae, Haemophilus influenzae, and atypical bacteria such as Chlamydia pneumoniae, Mycoplasma pneumonia, and Legionella species, and also viruses. So let's look at the types and causes of pneumonia. There are more than 30 different causes of pneumonia, and they're grouped by the cause. The main types of pneumonia is or are bacterial pneumonia, which is caused by various bacteria. The most common, as mentioned before, is Streptococcus pneumonia. It usually occurs when the body is weakened in some way, such as by illness, poor nutrition, old age, or impaired immunity, and the bacteria are able to work their way into the lungs. Bacterial pneumonia can affect all ages, but you are at a greater risk if you abuse alcohol, smoke cigarettes, and are debilitated, have recently had surgery, have a respiratory disease or viral infection, or have a weakened immune system. Another type or cause is viral pneumonia, and this type is caused by various viruses, including the flu, influenza, and is responsible for about one-third of all pneumonia cases. You may be more likely to get bacterial pneumonia if you have viral pneumonia. Other than that, there is Mycoplasma pneumonia. This type is somewhat different, has different symptoms and physical signs, and is referred to as atypical pneumonia. That's another name for it. It is caused by the bacterium Mycoplasma pneumonia. It generally causes a mild, widespread pneumonia that affects all age groups. And then we have other pneumonias. There are other less common pneumonias that may be caused by other infections, which include fungi. Okay, let's look at some of the common signs and symptoms of pneumonia. This one is the signs of pneumonia in children, such as loss of appetite, fatigue or irritability, high fever around 39 degrees Celsius, coughs, bluish lips or nails, chest pain, wheezing or noisy breathing, and rapid or difficulty in breathing. Here are some general uh, symptoms of pneumonia in adults and other population. We have coughing, fever, altered mental state, dizziness, chest pain, breathing problems, sweating, rapid heartbeats, and chills. Okay, who are at risk of getting pneumonia? So we look at age factor first. Pneumonia can affect people of all ages. However, there are two age groups that are higher risk of developing pneumonia and have more serious pneumonia. There are babies and children 2 years old or younger are at risk or higher risk because their immune systems are still developing. This risk is higher for premature babies. Then we have older adults, age 65 or older, are also at high risk because their immune systems are generally weakened as people age. Older adults are also more likely to have other chronic or long-term health conditions that raise the risk of getting pneumonia. Babies, children, and older adults who do not get the recommended vaccines to prevent pneumonia have an even higher risk. Then we have environmental or occupation risks or factors. Most people get pneumonia when they catch an infection from someone else in their community. Your chance of getting pneumonia is higher if you live or spend a lot of time in crowded places such as military barracks, prison, homeless shelters, or nursing homes. Your risk is also higher if you regularly breathe in air pollution or toxic fumes. Some germs that cause pneumonia can infect birds and other animals. You are most likely to encounter these germs if you work in a chicken or turkey processing center, pet shops, or veterinary clinics. Then the factor relating to lifestyle habits, such as smoking and usage of drugs or alcohol, can also affect uh, your mucus lining in your airways and also um, make you unaware and may accidentally breathe in saliva or vomit from your windpipe. Other medical conditions may also raise your risk factor of getting pneumonia, such as brain disorders like stroke, head injury, dementia, or Parkinson's disease, which can affect your ability to cough or swallow. This can lead food, drink and vomit, or saliva to go down your windpipe instead of your esophagus, and which can get into your lungs. Conditions that weaken your immune system may also increase your risk. These include pregnancy, HIV/AIDS, or an organ or bone marrow transplant, chemotherapy, which is used to treat cancer, and long-term use of steroid medicines can also weaken your immune system. Critical diseases that require hospitalization, including receiving treatments in a hospital intensive care unit (ICU), can raise your risk of hospital-acquired pneumonia. Your risk is higher if you cannot move around, or are sedated, or even unconscious. Using a ventilator raises the risk of a type called ventilator-associated pneumonia. Lung diseases such as asthma, bronchiectasis, cystic fibrosis, or COPD may also increase your risk of getting pneumonia. Other serious conditions such as malnutrition, diabetes, heart failure, sickle cell disease, or liver or kidney disease are additional risk factors. To diagnose you or your loved ones of pneumonia, firstly, they would check your recent health history, such as any recent surgery, or cold, or travel exposures, and the extent of the illness. So, based on these factors, your healthcare provider may diagnose pneumonia simply on a thorough history and physical exam. The following tests may be used to confirm the diagnosis, such as chest X-rays, which will look uh, at your lung, bones, and soft tissues and organs around the lung, including the lungs. Blood tests, so this will check if there's any infection present in your bloodstream. Sputum culture, pulse oximetry, which will check the percentage of oxygen in your blood. And this is an example of an X-ray of a person with pneumonia. So as you can see here, we have some white patches on his right side of the lung, or right side lung, which may indicate pneumonia. Other than that, they may diagnose you by using CT scans on the chest, bronchoscopy, which uses a flexible tube called a bronchoscope to enter your airways, pleural fluid culture, which will take a fluid sample taken from your pleural space, which is the space between the lung and the chest wall. And any bacteria or virus will be cultured. and be analyzed. For treatment is based on the type of pneumonia you have, how sick you are feeling, and your age, and whether you have other health conditions. And the goal of the treatment is to cure the infection and prevent complications. It is important to follow your treatment plan carefully until you are fully recovered. Take any medications as prescribed by your doctor. If your pneumonia is caused by bacteria, you will most likely be given an antibiotic. It is important to take all the antibiotic until it is finished. Even though you will probably start to feel better in a couple of days, you must continue the antibiotic to ensure no leftover strains of bacteria which may develop immunity to the antibiotic if you do not finish your prescription dose. Typical antibiotics will not work on viruses though. So if you have viral pneumonia, your doctor may prescribe an antiviral medication to treat it. Sometimes it's just symptom management and rest that are all that is needed. For prevention, uh, you may seek to get vaccination and immunization. Vaccines against bacterial infections such as Haemophilus influenza type B, pertussis, or whooping cough, and pneumococcal vaccines. For viral infection vaccines or immunization, for example, like the recent COVID-19, influenza, measles, respiratory syncytial virus or RSV for short, and varicella or the common chickenpox. Another way is to practice healthy living. Avoid people who are sick. You are sick, stay away from other people as much as possible. If you're working, then take a sick leave. You can also help prevent respiratory infections by washing your hands, cleaning and disinfecting surfaces that are touched a lot, coughing or sneezing into tissues or into your elbow or sleeve, limiting contact with cigarette smoke, or even better, quit smoking, and taking good care of chronic medical conditions such as asthma. Okay, that's all. Thank you. If you have any questions, you can leave them in the comment section below. Thank you.